This week, we are looking into Chapter 5, Clinical Information Systems. So what is clinical information systems? It comprises of electronic health records where you have patient records, patient information. You have CPOs, the computer provider or entry systems, medication administration, telemedicine, telehealth, and personal health records. But electronic health records and personal health records are similar. Um, so these are the main 4 or 5 main technologies or clinical information systems that this chapter will talk about. Various terms you might want to basically look at these terms, make sure you understand the differences, the key differences between these terms. Okay, for example, the difference between electronic health record versus personal health record. So this is basically a good differentiation, a good slide to basically understand this one, to understand the differences between EMRs, EHRs, and PHRs. Core functions, where we are today, EHR adoption. This is quite an old data, so I don't want you to be looking at this because the readings for this week will give you a better idea of the adoption trends, the most recent adoption trends. So don't worry about this data. Physician adoption, again, don't worry about this. I have an article, the readings. Under readings you will see, I will just show you. Value of EHR, major types of computer information systems, what are CPOEs, barriers to CPO adoption, the medication administration, what is telemedicine, telehealth, personal, and fitting the pieces. So you have so many stakeholders. So for example, you should begin with the patient themselves, then you have the care provider, the labs, the pharmacy, the payer, which is the insurance companies, the providers, obviously the physicians, nurses, the hospital clinics. So how do you fit these pieces, and why is the EHR required, and how it will allow the sharing of information between these various stakeholders, or the patient information between various stakeholders. So now coming to the readings, well, first I would like to start with the whole idea of electronic health records. Where are we going now? This is, although it's a 2013 article, but I think it'll help you understand why EHRs came about. You know, what was the whole idea of the U.S. government, Department of Health, to have EHRs, and sort of give you a sense of generally where we are. Although it's a 2013 article, a short article, 4-page. Okay. Next one I would like you to read on is the adoption trends. These are adoption of electronic health records in acute care hospitals, and there's a definition for acute health care. What does that acute health care really mean? So these are mostly hospitals that you know that are responsible for acute care. And what are the trends of EHRs within these hospitals? 2008 to 2014, so very recent. Then you also have this article talks about trends in electronic health records of in the United States for physicians, office-based physicians. So the local doctor that you visit. So what are the trends for those people as far as adoption of EHRs are concerned? And then this is a very good article to read about barriers for adopting electronic health records. I think this will allow you to give you a sense of why physicians don't or adopt, or what are basically the main reasons for they not adopting electronic health records. And then, since this chapter also talks about telemedicine, telehealth, mobile health is a kind of a overarching concept of telehealth, telemedicine. So this is a white paper by Deloitte Consulting. What is mobile technology and how it's transforming? So I just wanted you to read that. So just a sense of this is an important chapter, because basically it introduces you very specific. It introduces you to the various information systems that enable healthcare, patient care in the United States. And when you look at this data, then you look at the importance of EHRs, or these clinical information systems, you will understand that why technology is a big enabler in healthcare, and how it is transforming healthcare, how it's allowing better patient care, reducing cost, improving patient safety. I mean, I consult for a lot of healthcare providers, and most of my consulting work focuses on using technology solutions to make patient care better, improve patient safety, improve care coordination, So I think this chapter this week will give you a sense of the role of information technology. I mean, very specifically, the role of information technology. With that said, this is the end of the video. Good luck.